To determine whether one has a high thoracic outlet syndrome, that is, whether the scalene outlet remains closed, one may perform what is commonly referred to as a scalene stress test. The patient sits at the far end of the examination couch with her hand resting over the edge of the couch, and I am to palpate her pulse carefully and locate it accurately, all while observing the patient's breathing and remaining attentive to comfort. After that, when I have found the pulse, I perform a maximum external rotation of the shoulder, and the pulse becomes somewhat weaker, yet I can still feel it. Then I take hold of her head and apply full sustained stress on her scalene muscles in this region here. And I accomplish this by pulling the head into rotation and lateral bending in the opposite direction. If the pulse disappears when I perform this test here, there are signs I may pinch off the subclavian artery inside the scalene portal at this very moment. And at first glance, one would say, how could that be true since it uses two muscles indeed? But what actually happens is that the rib moves upward and compresses the artery when you perform this test. That observation is central to understanding possible pressure changes in that region during this examination. Thus, the test is positive for the scalene muscles if the pulse disappears. This can be supported by a few things because if the scalene muscles are hyperactive, you will also see an unilaterally elevated rib, and you can perform a so-called Adson test. I will show that later.